Good morning, WRCR listeners. It's Mark Brownstein here with Emerald Medicare. It's always a pleasure to be here at this wonderful studio with Will and Jeff. It is post-open enrollment, and so what I consider the fire hose activity has begun to slow down and ease. As a company, we helped so many people this season. We have a new office, a really nice office in Stony Point. It's actually 6 Liberty Square Mall. We were at 18 Liberty Square Mall. Come visit, come stop by, say hello to my team. We're a team of 7 there, helping almost 2,000 clients with Medicare in 26 states around the country. Licensed with about 17 insurance companies. So we can do what you need in Medicare. We're here to help. We enjoy what we do, and we love our clients. Open enrollment was an interesting time, especially with all of the ads that were on TV, especially with all the mail in your mailboxes, and I'm sure talking to your friends about what it is about your Medicare plan that maybe you want to change. And so we helped, worked with, supported over 500 clients this open enrollment. I'd say about 30% or so, maybe up to upwards of 40% of the folks that we worked with stayed with the plans that they had, which means they were calling really to inquire whether there was anything that's changed either with their plan or with opportunities to change a plan maybe to another carrier that would suit their needs better. In most cases, that wasn't the case. Probably the biggest area, and I'll talk more about it, is the prescription drugs. So when someone calls us and asks if to change their plan, our first set of questions is, what's working? What is it that you don't like? And in some cases, we're saying, okay, let's take a new look at your doctors. Let's see if there's a new carrier that maybe takes all of your doctors and see what kind of benefits they offer. So just yesterday on the news, there was a fairly lengthy report on MedAdvantage plans and how MedAdvantage plans are really hurting rural hospitals around the country. And it was an interesting depiction of MedAdvantage plans. And, of course, from my perspective, there are many people who, in some ways, have no choice but to get MedAdvantage plans. But in this case, it was really talking about the reimbursement to the hospitals for the care that's being provided. And so, I guess a few hundred hospitals have been closed, simply because they can no longer get the reimbursement that it takes to actually run their facilities. So that was surprising. I'm sure more information will come out about it, but there has been many articles in various news media about Advantage plans. And, from my perspective here in New York, MedAdvantage plans happen to work decently. And the reason it does is because New York is only one of 4 states in the country where one can start out with an Advantage plan and have it for a number of years. Many of the Advantage plans have a 0 premium. So you're not paying anything except for the Part B premium that you're paying directly to the government, either through your Social Security check or just simply paying a monthly payment to them. But the Advantage plans at 0 premium are really pay-as-you-go. So whether it's in some cases no cost for primary care, maybe $10, maybe even $15, that's what you're paying. You're paying $45 plus or minus for the specialist. And so if one's not using the doctor very often, doesn't have chronic conditions, in New York, having an Advantage plan has a great advantage. Because if something does change in years that go by, New York, Massachusetts, Connecticut, and Maine are the only 4 states in the country where you can actually change from an Advantage plan to what's called a Med Supplement plan, or really it's a Medigap plan, without any health questions, any underwriting, or any pre-existing conditions. Yesterday I was in the city. I was talking to a number of financial planners, and they were stunned by this particular statement, because even though people understand that changing a plan is possible during the open enrollment season, which is October 15th through December 7th, people don't realize in those 46 other states that they actually might, if they have an Advantage plan, have to go and answer health questions, and they can be declined. So it's really important for people to understand, especially in New York, Connecticut, and Massachusetts, which are three big states that I work in, that they can make a change. They can start off by saving some money. The cost for these Medigap plans per person is about $3,000 a year, which is no small amount of money compared to a zero premium plan where you pay as you go. These Advantage plans, the most expensive part of these Advantage plans is hospitalization and surgery. If you wind up being hospitalized or having surgery, it's not an open checkbook. It is between $1,000 and $2,000 for each visit to the hospital or for surgery. So people pay that particular kind of bill over time, and in many cases they're not paying the $240 to over $300 worth of premium for a Medigap. So everyone's needs are different. But these Advantage plans, first of all, again, Mark Brownstein, Emerald Medicare, 2 offices, one in Stony Point, one in Nyack. We service Medicare exclusively. That's really what we do. And I'm out there talking to people all across the county, all across many states. I was in Pennsylvania, I was in Maryland, I was in Boston, talking to CPAs, financial planners, other senior advisors as well. If anyone here who's listening to me would like me to speak to any larger group, I've been at churches, I've been at Rotaries, I've talked at many different organizations who really just want to be educated. To me, Medicare is all about education. It's not about making a sale. When people are educated, they feel comfortable. They know that we're confident in what we do and what we say. It's not like calling, let's call it the Social Security office, where you may actually get different answers to the same question. We're consistent. We've done this before. We have many clients. We've seen a lot of scenarios that are complicated and tricky, and we do our best to make sure that people get what they need at a price point that they can afford. But again, back to Med Advantage plans for a moment. Med Advantage plans have extra benefits. And that's what's on TV. Even on yesterday's TV program, they showed a small clip of Joe Namath. So, he's touting, and those carriers are touting some benefits that absolutely people like. So we're talking about benefits like, I'll go in reverse order. Healthy foods. Okay? Healthy foods, not beer. Healthy foods is one area that you may get $30, $35 a month for, but it's something. Over the counter, just vitamins and other things that are over the counter that you can get. In some cases, carriers don't offer anything. In some cases, they could offer $60 a month or $60 a quarter. Again, it depends on your doctors. Are your doctors in that network that provides these extra services? Hearing. Some of the carriers offer some hearing aids up to a certain dollar amount per year. Are they the expensive ones? No. Do they have a vendor that they would like you to use? Yes. Is it nice to have that extra benefit? For many people, it is an absolutely excellent benefit. Acupuncture. Some people use acupuncture. Some of the carriers offer 12 visits a year. And so that varies as well. Eyeglasses, contacts. This is different than optometry or ophthalmology, which is a specialist. So eyeglasses, let's call it $200, $250 a year for contacts or glasses. It helps. One of the carriers going forward into 2024, besides the actual gym membership, and there are 2 different gym memberships. There's something called Renew Active, which is through United Healthcare. And most of the other carriers have what's called silver sneakers. They both have different and some of the same gyms that are in there. But at least one of the carriers is offering, depending on the county that you live in, $600 worth of extra fitness-related costs that you can submit and get reimbursement. So it could be a pickleball racket, it could be a tennis racket, it could be a Fitbit watch, something to help you stay in shape, be healthier. It's a reimbursement. You pay for it, you submit it to the carrier. They will up to $600 reimburse you, and that's for the entire year. Nice features, nice benefits. Medigap, Med Supplement, offers none of this, and that's why people like it. And so it's sad to hear that there's a reimbursement issue to some of these hospitals because the plans are being highly marketed and being sold. So something has to give. The dental, that's the last thing I wanted to mention, is that different carriers will offer different dental options. Some of them will offer just cleanings and x-rays, maybe cleaning, x-rays, and fillings. But that's preventative. If you get past preventative and you get into more comprehensive root canals, crowns, those kinds of things, those are considered comprehensive services. So depending on the carrier, you might get the first $1,000 of charges that you spend at a dental office, and you submit the bill, you get your $1,000 back, or the dental office will submit for you. In some cases, you pay for it, and the amount that you get reimbursed for is based on the codes, right? So a lot of it has to do with coding, just like it does in the medical field. But in some cases, it's up to $2,000. So again, not necessarily dollar for dollar. Maybe the first $1,000, but other carriers will say, okay, we'll do your cleanings and x-rays and fillings for free. But if you have the more comprehensive stuff, we'll reimburse you at 50%. Again, 50% of a big bill in dental work is actually a nice thing to have. I myself have a dental writer, and I use it. And my dentist actually does submit it for me. I pay them up front, and I get a check from the carrier for the percentage that is determined to be something that they will pay for. But Med Advantage plans are managed care. So back to the news report that I spoke of earlier. Managed care, people are concerned about it. People worry that they're not going to get the services they need or they're going to get denied. What I can tell you in the industry, and this has nothing to do with the reimbursement rates for the hospitals per se, and just to make a point, is that the hospitals, that's the biggest cost for all of these plans. And so these Advantage plans are really looking at managed care for the purposes of trying to prevent you from going to the hospital. We know that many people go to the hospital because they either don't have coverage or they can't have access to their doctor. They can't get an appointment right away. Those are certainly industry issues, but the hospital costs are enormous. And so those costs add up. And so the reimbursement is a big issue. What I can tell you is that Med Advantage plans, especially in New York, work. And for many people, I say, based on their health and their budget and their doctors and their medications, try it for a year. If it doesn't work and you can afford it, then moving over to a Med Supplement or a Medigap plan may be the best option. But these plans work because of the extra benefits that I mentioned earlier. When people realize that they get these extra benefits, they all want them. And so that's not the question. The question is whether the carrier actually offers them. And so people are during especially open enrollment, contemplating the change back and forth. Again, in New York, it is a very easy state to make that change. The other thing I want to bring up as a part of this time together on the air is that prescription drugs have changed the carriers have changed their formularies. And so we ran hundreds and hundreds and hundreds of prescription drug plans for our clients. Because even if the prescription drugs didn't change going into 2024, it's not that the carriers didn't change their formularies or their costs. If somebody has an Advantage plan, they're stuck with that particular formulary. So they don't have actually a choice in terms of what prescription drug plan they are aligned with. They're aligning with that carrier whose doctors are in their network, and that's what they need to work within. For somebody who has a Medigap plan, on the other hand, they can change their prescription drug plan, their Part D plan, every single year because they can. And it behooves them to take a look at that particular issue to see if they're in the right plan. Many of the carriers are making some significant changes going into 2024 and 2025. Some of the carriers are doing what I would call a bait and switch, which means that they're looking at this year's pricing, last year's pricing, 2023, and they're saying, okay, we're going to raise the prices slightly on some generic medications, maybe go from a tier 1 to a tier 2, squeeze that a little bit extra money from the client, and maybe they won't really notice. And then in 2025, we'll just raise it a little bit more. For people who are on a standalone, there are carriers that lowered their premium to 50 cents, $3. But that doesn't mean that the medications, the copays, didn't actually change slightly. So the maximum out-of-pocket in 2024 is $3,300. So that's the amount of money that any individual can pay for all of their medications combined for the entire calendar year. That's a big change from 2023 because at the what's called the catastrophic level, which is beyond what used to be called the donut hole, there was a 5% cost with no limit. So a nice change. The impact is yet to be seen. The comments from clients will come through the year, and we will keep learning about the changes that have taken place. In 2025, the maximum out-of-pocket is actually going down to $2,000. Again, a significant impact on the people who have costly medications. So all of that is very encouraging. I'm excited about it, but also concerned about how it's going to impact folks that are on generics, folks that are actually paying just $0 or $3 for a particular generic medication. And those prices could, in fact, begin to inch up. Because I think we all know the pharmaceutical companies aren't going to start to lose money. And so their ability to sort of manipulate, change, adjust prices is something that they will do soon enough. So I just want to put a plug in here for my son, who's looking for a job. He's 21 years old. He's an ambitious kid, and he is at RCC, but he loves trading, but he's a kid who really is a hard worker. So if anyone actually knows of a restaurant or a job where he can work part-time and maybe even some odd hours, please call my office, 845-358-1220. I felt I needed to do that. It's helpful. So one other thing I wanted to mention is this upcoming time of the year is a special enrollment. It's January 1st through March 31st. And this period of time is a special enrollment for people who are on an Advantage plan. They have the ability to change their Advantage plan within those 3 months. Meaning that if they walk into the doctor's office and for some reason the doctor's office does not take their plan and they go, how is that possible? I spoke to someone on the phone. not Emerald, but they spoke to someone on an 800 number, and they told me this doctor is covered. What do I do? Well, they have an open enrollment period for 3 months that they can change their Advantage plan to another Advantage plan during that time frame. So in January, they can change it for February. In February, they can change it for March. And in March, they can change it for April. A great opportunity, not marketed at all, but an opportunity. And because we have our brochures and we know so many of the folks and so many of the medical offices, one of my staff people, Carrie Gagne, has been visiting medical offices all across Rockland, really to introduce our services. And so many of them are going to be sort of knowing that we can help. They've already sent us leads through open enrollment. But coming into this January timeframe, when clients are very surprised that something isn't covered, specifically that doctor, another opportunity to help people. But in addition, those 3 months are also a time frame when they can change to a Medigap. So people call us all year long, and something has changed in their life and their health. And because New York is a state where there's no underwriting or pre-existing conditions, they are often during the year trying to change to a Medigap plan, the better coverage, the more expensive coverage, but the coverage that really provides less out of pocket, but a higher premium. So there's Medigap plans for Plan N. It's $240 a month going into 2024. And Plan G is $306 a month. And so certainly a high cost, but it covers almost everything. There's a deductible of $240, but after that, on Plan G, there's no other costs. On Plan N, there's only a $20 office visit. So these are plans, these are expensive plans. And again, the reason why these prices are so high is because in New York, we're accepting clients who are not healthy. They're making the change without pre-existing conditions. So the insurance companies are aware of that. And so they're pricing it accordingly. Many other states, New Jersey, certainly, you go down south of D.C. and North Carolina, South Carolina, Georgia, the premiums are so much lower, less than half. So a Plan G could cost $110 as opposed to $306. So those are big opportunities for people as they look at this new year. They're using in some cases, it's their first time that they're using this new carrier. In some cases, they don't really understand the plans very, very well. We encourage people to take the phone call from the carrier, get an introduction. In some cases, they want to come visit. And they want to sit with you and just talk to you about your health. And it's not invasive, but it's an opportunity for the carrier to, again, address preventative, right, care, manage care. So the Medigap plans don't do that. So this managed care model has benefits. It is estimated by 2030, 70% of all Americans will be on an Advantage plan. I've spoken to many people, certainly in Rockland and all across the area, that are dealing with the New York City employees model, where they're being asked to or there's a lawsuit around changing over to actually an Advantage plan. And people are up in arms. They want to keep what they had. On the other hand, I'm not sure where the lawsuit will go, but it is, in fact, a trend to move towards Advantage plans. Again, back to the news media is, the reimbursement by the carriers or by the billing issues have to be addressed. So the deductible for Part D, I just want to mention that as well. And one other thing about Epic before I wrap up here today. The deductible going into 2024 is $545, but only for brand name medications. So if you folks are taking generic medications, the deductible does not apply. But as if you are or are prescribed a brand name medication, Tier 3, Tier 4, or Tier 5 is what it's called, then you are actually subject to meeting that deductible first. Once you meet that deductible, the price goes down. But it is an important component of, in fact, the prescription drug plans. And during the year, people can get prescribed something that originally they didn't let us know about because they weren't using it. Then all of a sudden they go into a pharmacy and it's costing $220 and they don't understand it. And they call us and we let them know that this is now a Tier 3 medication and they're subject to this deductible. So don't be surprised, folks. Or ask your doctor to give you a generic medication. If, in fact, you're using a brand name medication and you've already tried the generics and it doesn't work, then the doctor can actually submit what's called a tier exception report, and you can get that price lowered. So, these are sort of the tricks of the trade, having helped so many clients. Epic, which is the New York State Pharmaceutical Program, is another way to help save on prescription drug costs. So based on income, $100,000 as a married couple for last year's income, $75,000 for a single person of last year's income, you can qualify for Epic. If you qualify for Epic and over 65 years old, you actually have a special enrollment during the year to change your plan completely. It doesn't end the end of March. It can go into September, and you have Epic. So we encourage people who actually have that kind of income, lower income, to sort of look at what their options are. There's low-income subsidy. There's Epic. There's a Medicare savings program. So for those of you who are potentially have lower income, maybe on Medicaid as well, many of our clients have Medicaid and Medicare, and they're able to get some extra benefits that beyond what I've mentioned on Med Advantage plans. Much more transportation, much more dental, no cost on any prescription drugs. So again, Medicare and Medicaid. So again, I just want to acknowledge the work that I do and the work that our team does at Emerald Medicare. We are a hard-working team. We probably help 1,000 people a year, and I educate personally another 1,000 people a year. So it's all about education. I encourage you to get educated. I do webinars. I do seminars. If any of you know of a place for me to speak, please reach out, 845-358-1220. Our website is emeraldmedicare.com. Call our office. Stop in 6 Liberty Square Mall. Know that we're here to help, answer any questions. Happy to be a part of this community and grateful to be a part of WRCR. And thank you for listening. Have a great day and a great weekend and enjoy the holiday season and stay healthy and safe.